In conclusion, KPIs are a set of parameters aimed at assessing the efficacy and the safety of industrial processes, and here the practice of ART clinics. Clinically, there are three major parameters, which are the patient population, the procedures performed in the ART, as I said, the ovarian stimulation, the retrieval, and the transfer, and the outcome parameters, and we put the emphasis on sustained implantation rate because pregnancy rate can be erroneously pushed by transferring multiple embryos. These are intimately intertwined with biological KPIs. You do the best transfer, the embryo is of poor quality, it's not going to work. By the same token, the biologists give you the best embryos and you goof during the transfer, it's not going to work either. So in ART, procedures are intertwined between the clinical lab and between the lab and the clinical setup. So finally, KPI should verify the presence of protocols and SOP and list all the add-ons that are being proposed.
My take-home messages are that when you want to assess the quality of your lab, you have to find some KPIs that are exclusively related to the laboratory practice and protocols. This is the first step in assessing the quality of a lab. And we have to consider three types of area, which is the structure, the process, and the outcome. Not only the outcome are not always reflecting the total quality of the procedure, so we have to pay attention also to safety and not only to efficiency or effectiveness. We have to select a number of manageable KPI to be efficient. We cannot have 200 KPIs, otherwise we will never be able to keep under control unless we have incredible software, database, and automation in assessing, in collecting data. But this is for the future. So today we need to have a restricted number of manageable KPI, but for this one, we have to collect data and keep them under control continuously to be able to react to a problem, but also to react to an improvement. And because this is the way that we can build the future of IVF with better and better results. The control chart is the key to promptly identify and adopt corrective measures, but also, as I said, to improve. We have to consider that end of results, a live birth is a multidisciplinary effort, so we need to have also KPI in the clinics, and we need also to have a specific database to understand which is the patient population that we are treating, maybe different between one month and the other, and we have to account for this for these confounding factors. So we need to have a basis of statistics to make this kind of evaluation, or we have to find a reference patient population to use for our KPIs.